A Searcy mother is waiting to find out if her one-year-old daughter's open heart surgery can be done locally or if she needs to head to the West Coast. Well, the family isn't sure how they'll afford something like that. KRK4's Kayla Reardon talked with the baby's mom today about the complications that's causing concern for doctors close to home. Caitlin?
Well, Bob, to look at her now, you wouldn't know that she's sick, but her mother says if she doesn't get the life-saving surgery, she may not make it to her second birthday.
She's very outgoing.
Haley's mom, Hannah Parkridge, says that's because she was born with congenital heart disease and DeGeorge syndrome, a condition where part of the chromosome 22 is missing.
When she was born, she wasn't crying or breathing or anything.
Doctors immediately knew something was really wrong when they couldn't get her off oxygen after 2 days. She was sent to Arkansas Children's Hospital. At 2.5 weeks old, she had to have emergency heart surgery and spent the first 2 months of her life in the NICU.
Typically, with her heart condition, they typically don't make it through the pregnancy, and if they do, they only survive for 3 days.
She's a little miracle baby, but now the family needs another miracle. Haley needs another vital heart surgery.
Her arteries to her lungs are about less than 1 millimeter small, which means she's not getting adequate oxygen to her lungs.
Hannah says their options are limited.
Not that many people feel very confident in doing it because they could cause more problems.
A doctor in Stanford, California may be their best hope, but that trip and the surgery come with a cost, and time is running out. What happens if she doesn't get the surgery?
She's probably not going to survive for very long.
Haley's family says in the short years she's been a part of their lives, they can't imagine being without her.
I mean, she doesn't look sick, but I mean, you wouldn't even think there was anything wrong with her, but her heart is sick.
Now, Haley will have to have another surgery in 5 to 7 years, but Hannah says after this next surgery, she hopes that Haley will be able to live a pretty normal life.